interest. That shows your interest for anatomy. So it is very important for a yoga trainer to know anatomy, because when a student comes to you, like asking what change is going to happen in my body, then you should be able to address them, right? And the current era, the present condition in which we are in, everybody Google and come. Even the asanas which you teach in the class, they Google at the end of the day and they say, I have diabetes, you taught me this asana. So why is it? So there are links and circuits within the body. Okay. So you should be able to tell them and make them aware of what is going within the body. Before that, first we have to understand, isn't it? So it is very important that what change yoga is doing to our body. So we should understand that. So that's the importance of knowing anatomy. It's quite fortunate that you are part of Bodhi Yoga Academy, where they give a lot of importance in educating you from all the spheres and all the planes. Okay, so so today let's quickly brush through the few systems which were discussed. I heard all of you are from level 2. Yes. Okay.
Yes, ma'am.
Great. So you are aware of few systems, right? 1 second. Right? Yeah. Okay. So we'll keep asking some questions then in between. Okay. So is that fine?
Yes, ma'am.
Yeah. Oh God, you are very much yes-minded, all of you. Happy to see that. So we'll just discuss everything in brief, okay, and we'll see what are the diseases in detail. We'll interact in between. I'll call some of your names and ask something. Like you can share whatever you would like to share. Okay. Yes. So let's begin and enjoy the anatomy session. You know, anatomy is a very interesting subject. It's knowing about ourselves, isn't it? So the most important person in the planet is whom? Who is the most important person in the planet for you? Yourself.
Me, myself.
Yeah.
Chitra is doing like this,
Myself.
Chitra.
Yeah, I can see. So it's yourself, right? So that's the beautiful aspect of anatomy, where we become aware of each and every inch of the body and what is passing through. So what is happening with it? Okay, so let's begin. So first, let's start with that system, right? Which you all are very much aware of the system in this 2 years of the lockdown and all the, you know what is oxygen and what is the lungs and everything, right? From nose till
Respiratory.
respiratory system, right?
Respiratory.
Yeah. So we'll begin with the respiratory system. Okay. So now, before that, I have a quick question. Okay. So why respiratory system is more important? Now, when you do a pose, why is breath so important? You can actually do a pose, right? You can move the body, make it flexible and bend it. Why is breathing necessary? When your trainer is telling you, put your breath or focus your breath on that part, take deep breath in and out. Why? What difference does it make?
Because when we be in any pose, so our muscles are really involved, our skeletal system are really involved. So for that strength, for that be in a pose, we need energy, and without oxygen we cannot burn our carbohydrate into energy. So for that we need breathe in, and because of that metabolism, energy metabolism, there are lots of detox there, toxins there, like carbon dioxide and all. So we need to exhale so that those toxins go back outside of our body. So that's why we need deep inhale and exhale.
Oh, wow. So you've said it all. So I don't have anything left. So that's nice. That's very comprehensive, Snehaji. Subhash, you want to say something?
Yeah, ma'am, I'm saying like our body consists of cells, and it is actually fundamental of our body. So every cell required this oxygen. So without oxygen, even though we cannot live 2 to 3 minutes. It's a very important for our body because every cell requires this oxygen.
More oxygen is there, more blood flow will be there to that particular portion or particular part or the organ. So the better blood circulation is there, better is the functioning of that particular organ.
Actually, respiratory
Also-
system is different from circulatory system. So blood flow is involved with circulatory system, which is a different system. Those are interacting. Blood is carrying oxygen, but there is nothing to do with our breathe with blood flow, I guess.
Ma'am, it also cleanses the lungs.
Yes. Okay. Good.
Ma'am, I believe that breath works as a cheat code, and while doing any yoga pose, we can't hold on our breath. So basically, breath helps us to keep the flow moving on.
So to move on in life, isn't it? Yes. Great. I'm happy to see all your answers. Right? You seem you've started your journey in anatomy, and you are very much aware of many things, right? So respiratory system, okay, that is the system which is responsible for, okay, inspiration and expiration, and also perspiration, right? So do you know what is perspiration? When you get perspired. So that basic entity of the body, which is important for us to basically take oxygen into the body. Our human body is just functioning based on the fuel or the energy called oxygen, which is generated through breath to the food which we take, okay, and various sources. So now our respiratory system is that which helps in the process of breathing. All right, kindly mute yourself. Okay, mute yourselves, and you're always free to mute and express when we ask something. Yeah. So it is that which helps in the process of breathing. It is quite obvious, isn't it? It includes a sequence of inhalation and exhalation. It's just the breathe in and breathe out. Okay. So you know what is life? Life is a journey between an inhalation and exhalation. Isn't it? We come onto this planet with a deep inhaled breath when the baby cries for the first time. And the last thing we do is leave a breath, exhale, and the person expires. So life is a journey between inhalation and exhalation. That is why yoga has chosen this particular aspect as the secret of maintaining the body's health. So inspiration is nothing but intake of oxygen. Okay, even when you say I'm inspired from someone, it gives you a lot of energy. Expiration is outflow of carbon dioxide. So when you breathe in, you take oxygen, breathe out carbon dioxide. It's sent out. So respiratory tract is of two parts. For our understanding, we divide it into two parts. All right, upper and lower. Okay? As you can see here, it begins from nose and goes inside deeper, and okay, there's a tube here, and then we have lungs. So the upper tract is nose, pharynx, and larynx. You will see what are these. And the lower has this tube and the lungs. Now you can just become more evident with the functions. Okay, do not panic with the terminology. Okay, with the words or these terms, pharynx and larynx. What is pharynx? What is larynx? I guess you all are aware of it. So nasal cavities, from nose we breathe. The air which we breathe, it enters through the nose, and this is the nasal cavity. And from the nasal cavity, it enters into this region. A tube till here is called pharynx. Okay. Now this pharynx is connected to nose and mouth and also the throat. So it is divided into three parts. You'll see that. This is called larynx. Okay. That organ which is responsible for all the beautiful singers, speakers, and orators. So the voice box. The larynx is the voice box. till there, it is called upper respiratory tract, upper half, the lower half. From there, now we are going deeper. Lower contains trachea. One see from here, this is the larynx, isn't it? And from larynx, we are moving down. This is trachea. Okay, this is a tube. So from here, we end up in bronchi, and these are the lungs. Okay. So this is about upper and lower respiratory tracts. Now, even your Ujjayi breath or the pranayama, deep inhalation, holding, okay, puraka, kumbhaka, rechaka. Okay, so they are playing different roles. We'll discuss that at the end, how they affect our body. So what are the parts? Again, you all are very much aware of this. Nose, right? Nose and nasal cavity. That's just the nasal passage. All right, nostrils. And then we have pharynx and larynx. And this is called windpipe. Okay, trachea. Trachea is the windpipe, that tube in the body through which wind passes. Okay? That's as simple as it is. And these are the lungs. Okay, so lungs are responsible for, they are the factories of oxygen. So whatever we take in, they take the oxygen and send it to the body, and they remove the carbon dioxide and send it out through the breath. So they do the major functioning. Even heart is a muscular organ. You know, heart just pumps. Okay, but conversion of oxygen, bad blood into good blood, is done by lungs. So this is the major target of yogic practices. Okay, hence you are affecting the key factor of our body. So just remember that. And the last part is that diaphragm. This you can see here, right? This muscle. This is a diaphragm. That is like a disc-like structure. Okay, this structure moves when we breathe in, and it also moves when we breathe out. We'll see how the movements are. Okay, now we know what is nose. So nose is just an entry portal of air, isn't it? Yeah, and responsible for the knowledge of smell. Now you knew all of this, right? You were very much aware of lots of smell and how it feels, and various secretions of come out through nose. See, now when I talk about nose, I would like to say in Ayurveda, it is said, Nasahi Shiraso Dwaram. Okay, it is said nose is the entry for the head, entry portal for the head. You know how nose is connected to the eye through a tube, okay, through a duct, and it is connected to the ear through a tube. Okay, and it directly opens into the mouth here. You can see it, right? Nose is directly opening into the mouth here. And as nose goes in like this, we have small serrations here. We have small cuts through which the smell nerve passes. So it is also has a access through the head or the brain. That's why Ayurveda says Nasahi Shiraso Dwaram. So nose is the door for the head. And once you give any medicine through the nose, it automatically affects the entire body. So each and every, there is no yoga practice, asana or pranayama or anything without the breath work, isn't it? Do we do anything without breath? No. If there's anything, then we'll share it. Well, you can share at the end of the session. So this is why nose is present for air to humidify. Air gets humidified and air gets warmed. Air is filtered by hairs in the nasal cavity. And nose acts as a connection to the head. Okay. Just like a tree has roots under the ground and branches above, human body is reverse. Okay, human body's roots are in the head. It is said in Bhagavad Gita also, and also in Ayurveda. They said urdhva moolam adho shakaha. That is why nose plays a major role in stimulating the brain and also the respiratory system. Fine. Now, next is, this is the sinus. You have some few colorful things over here. So what is a sinus? Sinus is just a small air-filled cavity in the skull. See, the skull means the skeleton, right? Head. You have the danger symbol. Did you ever see the danger symbol? Yes? No?
Yes, yes.
Yes. Yeah. So you see the head in the danger symbol. That is the skull. Okay. So that skull is actually a bony structure. It is made out of bone. But these air spaces will keep the skull light. It's obvious, right? If you fill a bag with water, it's heavy. A bag filled with air is light. These tiny spaces here, we have different sinuses. So their function is to keep the body light and the head light. Okay. Now, if somebody's headstrong, that doesn't mean their sinuses are filled. Okay. It's the headstrong means something else. Yeah. So sinuses drainage happens when you do the anulom vilom. Okay. The pranayam or the nadi shodhana pranayam cleanses the entire all the sinuses. Now, what the sinuses do is they keep lightness of the skull. Okay, that's what they do. And resonance of voice. If we have to speak, there should be some air space within so that the voice resonates. So because of the sinus, the voice resonates. And they affect the brain. And it produces mucus and also moisturizes the nose. Okay, that's about sinus. Now from nose, once we are entering inside, imagine you are going inside the body. It's a journey. Like if you have ever been to a planetarium, you see different things. You are entering into space, isn't it? So we are entering into the respiratory system. Okay, have that enthusiasm. Now pharynx, once you go inside nasal cavity, so this tube from, this is nose, nasal cavity, from here till here, it is the pharynx, right? So we have three parts of the pharynx. Nasopharynx means back of the nose, that's it. Oropharynx is back of the mouth. Laryngopharynx is back of larynx, that's it. Okay? It is again a tube through which air is passed. Now, it is a part of both respiratory and digestive systems. That is very important. You know, the same, see this is the same tube here. Air comes from here. Food comes from here. Okay, but the segregation, the separation happens because of this structure. You see a thin flap here. Okay, this flap closes. This flap closes and sends the food into food tract, air into air tract. Sometimes, you know, when that's why they say you should not talk while eating food, because there are chances of food entering into air tract and air into food. That's when we feel that sensation and body sends it out. So this is pharynx. It is a part of respiratory and digestive systems. It carries both food and air. At the bottom of pharynx, it divides into two structures. These two. Okay, this is larynx and this is esophagus. Fine. So two structures, and a flap-like structure called epiglottis. As I said, there is a leaf-shaped structure. This structure prevents the entry of food into the air pipe and air into the food pipe. This leaf-like structure. Okay, that's it. You can, all you have to remember is the pharynx is connected to both respiratory and digestive systems. So next, once we have entered into pharynx, now we have gone in deeper inside. This is the larynx. Okay, larynx means voice box. Yeah. So, okay. Now, see, I know all this sound like some characters from a Hollywood movie, isn't it? All the names, Greek and Latin. Okay, but it is pretty interesting. Okay, so larynx is this voice box, which you can see here. Your main Ujjayi pranayam affects this region. Okay, this is called Swara Yantra in Sanskrit, and it affects the entry of air and also knowledge into the head. Okay, this is a very important organ. Next is trachea and bronchi. Now from larynx we come down, we have a trachea here. This was larynx. Okay, this shaped structure. This thing is the voice box.
నాకైతే యాక్సెసిబుల్ గానే వాళ్ళు నాకు గ్రామ పంచాయతీ అయినా సరే గానీ
Yeah, we will discuss about gram panchayat at the end. Okay, and we will see the trachea and bronchi now. Yeah, so it's good, sometimes when things like that happen, people will come out of sleep. When we feel asleep, then, then you come out of sleep. Yeah. So trachea is the windpipe. It's called the windpipe. Fine. And bronchi is the connection between trachea and lungs. Now, so this tube is called the trachea, and they end up into small branches. These are called bronchi. And you just remember the picture and the function. Do not bother or worry about the names. Now, so remember this end point. Okay, when this tube ends up into these tiny things. So you just breathe in, you say, but it travels through a long journey. It's a very long journey. It has to go through all these tubes and then till the tip of the trachea, that is bronchiole. Now, what is at this tip is this colorful structure, blue and red. We have alveoli. They are tiny balloon-shaped structures, right? Why this is the most? Actually, this is like the heart of the respiratory system. They carry oxygen deeper. Now, this red, okay, these red structures take good things. It gives oxygen to the body. These blue structures, okay, they bring back the bad thing, and that bad thing is sent out of the breath. Okay, a filter through oxygen enters from air into the blood. Now, which air which we breathe in, the oxygen is sent through a filter into the blood vessels, into the red artery. Okay, now vein brings the bad blood and it sends out through the air. Carbon dioxide goes out of the blood into air. See how beautiful is the designing of human body, isn't it? So it is a never before and never after invention, isn't it? Gaseous exchange. Now, this is what a brief thing. What happens is that this is the alveoli. It is like a cut. You have cut it and you're seeing inside. Now, the air you breathe enter here. It enters here, and the oxygen is sent into the blood. And now, this blood which has carbon dioxide is sent into the alveolus, and it comes out. Now, when you are having low oxygen levels, that means this filter, okay, your body is not able to receive oxygen from the lungs into the blood. Now, this picture is very important because each and every day, each and every breath with awareness is affecting this part. It is expanding the lung capacity. It is cleaning this filter. So it is sending more and more oxygen into the body. So this is the place where yoga is affecting. Okay, that is why we come out of the oxygen crisis when we do pranayama. Patients' recovery is soon when we do pranayama. Okay, so this is the reason. Why? Because this filter is more cleansed. Now, lungs. We have 2 lungs. If anybody has 3, you can share. Is there anyone? No? So it is left and right. Okay, left lung and right lung. Now, they have 3 lobes. That means they have just, this is for our understanding actually. Right lung has 3 lobes, upper, middle and lower. Left has 2, upper and lower. Now what happened? They're just balloon-like structures. Imagine 2 balloons on the 2 sides. So they inflate. They grow bigger when you breathe in. When you breathe out, they become smaller. They deflate. That's just lung is all that. The act of breathing. What happens when we breathe is when we breathe in, the diaphragm relaxes. This is relaxing. Okay. And the chest expands. Chest is expanding and air is in. Now here you can see again the diaphragm. When you send the breath out, the diaphragm contracts. Chest contracts. Air is sent out. This is the act of breathing. We have respiratory diseases. Okay. So we will see one by one. Before that, we thought we'll share a secret with you today. So I just said that the secret of yoga is changing your life through breath, isn't it? Yes. So, what's the difference? How can a breath, hardly which is visible, how does it change my life? Okay, we have an example. Most of you might be aware of it. Okay, we have two friends here sitting on one another. So a dog breathes 30 times a minute. Do you know? Okay, we breathe for 18 to 20 times. A human being takes 18 breaths. One breath is breathe in and breathe out is one breath. Okay, so a normal human being takes 18 breaths in a minute. Okay, that is a natural way of breathing. Now, coming to a dog quicks, it breathes quickly, isn't it? Did you observe? Did you ever see a dog? So it's always doing, yeah. Yes, I see. Meenakshi she's showing. So yeah, so a dog lives for 9 to 14 years. That's the lifespan. So it lives only for 9 to 14 years. A tortoise breathes 3 to 4 times a minute. It arams takes breath. It relaxes and it's naturally doing a pranayama. We think it's slow, but actually it is cool. So it takes 3 to 4 times in a minute, and tortoise lives for 150 to 400 years. Okay, so the secret of life is in the breath. More holding of the breath, more prolonged your breath, longer is your lifespan, healthier is your life. Okay, so the art of breathing, when you can know how to breathe and use the lung capacity properly, that's when healthy. Okay, that is the secret of yoga. So deeper the breath, okay, more deeper the breath, longer the lifespan. Your lifespan is longer, broader the awareness, your awareness increases. You become more aware of each and every part of your body, each and everything what you do. Stronger the consciousness. Okay, so this is what yoga does. We have opened some secret of the Maharshis and yogis. So I know all of you are aware of this, but just remember that is you are affecting at a very deeper level. So now this is the yoga. So we will see the basic diseases. Now first is asthma, bronchial asthma. The word asthma means, see, you can see the picture here. Now we have briefly seen the entire respiratory system. When a person has asthma, when a student comes and tells you, I am asthmatic, that means this is the normal airway. Okay, so through this tube, air passes. Through this tube, air cannot pass that much because it is blocked. It is blocked with the mucus. So this is normal person, this is asthma person. That means their airway is blocked. This trachea pipe, okay, you remember, right? So this pipe is blocked with some mucus. Now, practice of the pranayama gradually clears the mucus, okay, and it increases the lung capacity. Now, why mucus forms? It is because of the food habits. Sometimes taking excessive milk products also causes mucus, and irregular lifestyle, staying awake at night, air conditioned environment, etc. There are many reasons for asthma. It is called bronchial asthma because it is at the level of bronchi, this last level. Now, if you remember, you have seen the alveoli, they will not be able to take oxygen in case of asthma because the muscle is relaxed here, more air flows in. Here it is tightened, so more air cannot flow. And we have chest opening asanas, isn't it? Yes, we have many chest opening asanas and postures, right? Chest opening and closing. And we had this thing called prone ventilation during COVID. Doctors have advised to sleep in prone position, sidewards, supine. And isn't it? That's what the Surya Namaskars do, right? That's what we do in Surya Namaskars. We close our chest, open up. Again, bend back, again, close, open up. Yes. So a regular practice of it will prevent asthma and also reduce the attack of asthma. You can plan your own breath sequence or your own asana, chest opening things and meditation and relaxations. Bronchitis. Now, See, bronchitis means an infection or inflammation. Inflammation is just a hot reaction in the body. If some foreign body has entered into the body, then body starts fighting with it. Okay, it starts fighting. In that process comes a procedure called inflammation. Okay, so in this process, as the body is fighting now, it may not be able to take that much breath. In the process of fighting, lots of secretions, liquids are formed. So one such liquid is the mucus or phlegm which comes out. So in this process of fighting, so this is the normal bronchi, and this, in inflammation there is mucus and they get cough, they get dry cough, okay, and then they also get wet cough. It depends how long is it. Bronchitis bothers the person for long time. They get affected by dust or any trigger, any foreign body, and it causes discomfort in the lung. Okay, now coming to asthma, breathlessness, breathe difficulty is the main symptom of the asthma. Yes, please.
Ma'am, one more thing I would like to add. In anything, it ends with itis. It means pus formation or inflammation. Anything.
Yeah.
Yes. So this
Yes.
is
Wonderful. Absolutely right. As I haven't seen your name, ma'am. So as you said,
it's
itis.
Sneh, ma'am.
Sneh. Okay, yeah, Sneh. So bronchitis, anything which ends with itis is inflammation. That is a reaction happening within. We have tonsillitis, sinusitis. Okay, all the itis doesn't mean IT industry. It means the inflammation.
Yeah,
Okay.
and inflammation it means more of mucus and pus formation. Like in skin or in pimple, there is yellow part is also inflammation, redness,
Yes.
everything.
Yes, absolutely. Yeah. So in the process of fighting, as I said, we get some fluids called mucus, pus, or any things. That is just body captures the foreign substance and it sends in the form of pus outside. Okay, bacteria or cells or virus or any foreign body.
Yes, this is kind of immunity system for us.
Yes.
Body
system. Now, pneumonia. Next is the pneumonia. Okay. This is also caused by a organism, a microorganism. Okay, just like aware of COVID was caused by a virus. Okay, so pneumonia is also caused by tiny organism. It is taken inside, then it starts blocking the lungs. That's when lungs start fighting with that foreign body, and again, see, the air sacs are filled with fluid like this. Okay, so that is when the air sacs are filled with fluid, and then the person starts feeling heaviness in the chest, breathing difficulty, cough. Okay, and they take some time to recover. Even once they recover, they have the weakness. Lung will not be able to take the entire breath and entire oxygen in the breath into the body. Tuberculosis, TB, right? All of you might have heard of TB. TB or tuberculosis, short form is TB. Now, in tuberculosis, again, here also there's an organism called Mycobacterium tuberculosis, a small bacteria that enters and it starts causing, see, this is a tiny organism that causes the trouble. See, each and every organ is at so much risk and danger. Imagine how much your body is struggling to prevent your health. So, in active TB infection, person may experience chronic cough and blood with mucus. Okay, so that is about TB infection. TB weakens the person. How a person gets tuberculosis is when they come in contact with another TB person. This weakens the lungs. We don't know, like when we pass by, we don't know who has TB, and they cough in front of you. You inhale that, and that's how we get tuberculosis, right? And allergy. Now, the most favorite thing is allergy. Okay, so you know what is allergy. I didn't tell this in detail. There is a substance called allergen. Allergen creates an allergy. Body is allergic to something. May it be dust. Okay, may it be bacteria, or may it be pollen, okay? And may it be any inhaling smoke. Sometimes, when we don't wash the pillow often, then there is some dust captured over the pillow or any surface of the house. That's when we inhale and we also catch up allergy. There are something called fomite. Fomite is a small, tiny dust which we cannot see. It is over the kerchief, napkin, pillow, etc. So why allergy happens is body takes it as the foreign thing and starts preventing yourself from that part. So body is hyperactive. Actually, body thinks, okay, something is coming. Let's alert. Okay, defense system gets alert, and that's why we get an allergy. It is the body's good reaction, but again, yogic practice will help reduce the allergy. Okay, too much of it is not very convenient. It causes other effects. Now, lung cancer. See, lung cancer majorly results from lowered immunity. There are few cells called NK cells, nature killer cells. So they increase when we do yoga and pranayam. When we do the breathe in and breathe out pranayam holding, that is when the body takes in the positive breath, repairs itself and sends out the negative breath. That prevents lung cancer. Okay. Now we have seen this, and see, pranayama means pranasya ayama iti pranayama. The practice of spreading prana, life force, is called pranayama. You should know why we are doing pranayama, because puraka, 3 steps, right? Puraka inhales oxygen to the maximum into the body. It takes in oxygen, and then kumbhaka retains oxygen to deeper tissues. When you hold, okay, so the longer you hold, that is how long the oxygen goes into the deeper tissues. And Rechaka it exhales toxins and carbon dioxide to the maximum. So each and every step of pranayama is very important, and it is capable of improving the immunity in any condition, not only respiratory diseases, it is for the entire body. Each and every cell releases a tiny packet of oxygen. Okay, so pranayama acts at the level of very tiny cells. And many researches are done on this. Okay? There is also a research article called Science of Breath. We have many researches how pranayama improves the condition of the patient or a person suffering with illness. And also to move towards wellness, we have wonderful pranayams. Nadi Shodhan pranayam, it balances the brain activity. You have left brain and right brain. I think you remember, right? When we discussed the nervous system. So it balances both and it clears the nose. Bhastrika cleans the lungs. Okay? It clears the lungs. It's like you clean your lung and switch on the digestion, stimulates the digestive fire. Commonly, small kids, when they do not have good appetite, isn't it? You can make them, make it a game of doing Bhastrika, and it improves their appetite. Kapal Bhati. Kapal Bhati is a powerful pranayam which detoxifies and removes gases. It's a way of flushing things out. Yes? Okay. Last is Ujjayi pranayam. Now, Ujjayi pranayam is that which stimulates the brain, endocrine system, hormonal system. It basically stimulates the thyroid and pituitary gland and opens the sense organs. Okay. Now, see, when we discussed all the diseases, respiratory diseases, pranayam is very effective for asthma and bronchitis. And sinusitis and allergy, Nadi Shodhan is very good. Okay, Nadi Shodhan is good. And you can also try any kind of pranayam in your personal practice. And Ujjayi breath is also good to get out of throat infection and any disturbance in the throat. Okay, so we have many deeper benefits. If you talk just about respiratory system, it goes so long. Each and every system is so deep. We'll just discuss the brief versions. Now, asanas, our favorite pose, snake pose, bhujangasana. Now you just to see the chest part of the asanas, thoracic cage. Okay, see here in this picture, the chest is just rising up. Chakrasana, it is completely inverted. The chest is opened up, right? And also things like Ustrasana, it is opened up. You know, when we breathe in, not all the parts of the lungs are not taking the air. You know, some part of it takes the air and the same part sends it out. But the upper part, middle part, lower part, if all the entire lung has to be used up, that is, then you have to do the asana along with breath. That's the reason we do asana, right? Asana is the step, first, third step in Ashtanga Yoga, right? And next pranayama comes. Now Dhanurasana and Setu Bandhasana. So all these things are again opening, and they are different closing postures, isn't it? We have different closing postures. We have the Padhastasana, that is again we close the thorax, right? So we have different and different poses. Now, the reason behind explaining the respiratory system first is because if there's no breath, there's no life. And even if you know breath, okay, K-N-O-W, know breath, and you automatically you know life. Okay, so that quote was from His Holiness Shri Ravi Shankarji. So thank you. This was about respiratory system. And now we'll see the